Hi, I'm Bret McFarlin. I work as a general internist at Broadlands Medical Center, the safety net hospital for Polk County, Iowa, and this is my story. I became a doctor because I felt it was important to give back something of service, to provide some service for those less fortunate than myself. My family was a rural family in Illinois. I was always encouraged to engage in education. It was seen as a way to better oneself. There really weren't role models in that place and time, but there was opportunity. The society as a whole supported education, and there was ready access to more ready access to resources I think there are now for the less fortunate to go to school. And I took advantage of that and found that I had an affinity for that kind of work. My daily practice of medicine in a safety net hospital is largely serving the people that are underserved, that have limited social support, limited resources. Broadlands had the distinction prior to Katrina of serving the largest percent of uninsured of any safety net hospital in the country. It's not unusual for us to see people present very late in a state of chronic ill health. It seems to me that these are people that are largely disenfranchised. They don't truly believe the system is there for them, and they don't seek the support of the system until they're desperate. And so they'll present very late in very florid examples of diseases that we see every day in much more modest presentations, diseases like diabetes and its complications, congestive heart failure and its complications, chronic lung disease, chronic hepatitis, HIV, and generally these folks are sicker than they should be or need to be because of their delay to access to care. It's implicit that some of us are treated different than others, that just as an accident of our station of life, that we may or may not be provided with the appropriate level of care consistent with what we currently know to be best medical practices. When I repeatedly see examples of people that are suffering increased complications, increased need for acute healthcare interventions, and almost certain to suffer complications prematurely in their life, I have to ask myself, why have we developed a system that lacks the priorities and the incentives to assure that that kind of care will occur? It seems to me that we've neglected or abandoned the concept of social solidarity, where we all really are in this together, and what happens to the least of us happens to all of us.